All right, so what we want to do to finish up this topic of blood vessels is be comfortable with blood pressure. When we think about the circulation physiology, what we're really looking at is the purpose of delivery through blood pressure. So blood pressure and arterial pulse taking help us to get a general idea of our circulatory health. So as a healthcare provider, you will be taking people's blood pressure, measuring their blood pressure, and trying to determine two things. You can determine a heart rate, and you can determine the degree of pressure in a blood vessel and estimate cardiovascular health from these pretty simple clinical measurements. So when we're measuring blood pressure, we want to be able to access an artery that is close to the surface. So there's a good example of an artery that's close to the surface is on either side of the trachea in the neck. We have a carotid artery. Now, there's a right and a left carotid artery. You want to use the tips of your fingers, not your thumb, tips of your fingers to palpate on either side, one at a time, not both, for a pulse. So if you start in the middle of your neck and you move laterally till you drop sort of off the trachea, you'll feel a pulsing blood vessel on one side. And that's the carotid artery. So you can measure heart rate from that. And in the arm, on the inside of the arm, there's an artery that can be palpated, felt, or the radial artery on the thumb side of the wrist, these are examples of where the artery is close enough to the surface that you can feel the pulse. When you feel the pulse, you get a measurement of heart rate. And when you can put a cuff over that blood vessel, you can also measure blood pressure. Now, you don't want to put a cuff around your neck because it would block both arteries at the same time, and that could cause you to faint. Not a recommended practice for somebody who's a healthcare provider trying to look after somebody's health. So blood pressure is a way to measure and get an estimate of how healthy the circulation system is, as well as getting a rate of pressure. So keep in mind that the blood pressure is established by the left ventricle when we're looking at systemic pressures, and that it'll be distributed as we go further along the length of the circulatory system. So we have kind of a classic blood pressure. So blood pressure is classically considered to be plus or minus a systolic number of 120 over a diastolic number of 80. Remember that systolic was a contraction phase and diastolic was the relaxation phase. So 120 represents the pressure that's going to be pushing against the blood vessel wall as a result of stroke volume delivery to that blood pressure, to that blood vessel wall. And the 80 number represents the average pressure on the blood vessel during diastole. So we can have an upper limit. We can sort of probably be in somewhere in the vicinity of 140 to 110. It's often a little less in women than it is in men, and probably somewhere in the 70 to 90 range for an acceptable kind of blood pressure, understanding homeostasis and variations in body size and other genetic factors and those sorts of factors that will play a role in a normal blood pressure. So this pressure that's being applied to a blood vessel will depend on the health of the blood vessel. If the blood vessel starts to get rigid, it won't absorb the force very effectively, and blood pressure will start to rise as it gets measured. And this is what sometimes happens in the older population. Blood vessels get harder, less elastic, and so that's reflected in a higher blood pressure value, and may indicate an increased risk for certain types of pathologies. So keep in mind that for our course, we're learning normal anatomy and physiology. So we understand that if we're outside normal, too high, that's called hypertension. And if it's too low, it's called hypotension. Both of them can have negative effects on health. If there's hypertension, we can have too much pressure in a capillary, and it can make things too leaky, or we can cause damage from the high pressure, causing scar tissue and reactive type growth in blood vessels that reduces their ability to deliver. And if it's too little, hypotension, we may not get enough delivery to cells and tissues, and that might result in dysfunction as well. So our goal is to try to maintain a blood pressure in this sort of range that we've described here. And we can also describe blood pressure as an equation. Some of you don't like these equations, but blood pressure is a reflection of two main functions in the body: cardiac output and total peripheral resistance. So we know a lot about cardiac output. We know that it had its own equation, partly why we started today by talking about that. And it was a function of heart rate times stroke volume. So we know the factors that play a role on cardiac output. We can alter heart rate, we can alter stroke volume and get different changes. But what about this total peripheral resistance? So total peripheral resistance refers to the afterload, the work that the heart has to play to overcome this resistance. So there's three main factors that we consider. We can also, maybe we'll talk even about four. So one is blood volume. So I think it's pretty straightforward that if we have more blood volume, we're going to have more blood pressure. So that's a factor. If we look at the characteristics of blood vessels, the more length we have, total length, means there'll be more resistance. So you can appreciate that the blood vessel length in the pulmonary circulation, it's much less than the blood vessel length in the systemic circulation. Systemic circulation has to pump from the heart to all the way down into the feet and up into the brain. So we've got much more blood vessel length to consider when we look at the systemic circulation. Blood vessel diameter is a factor. So you can appreciate that if the diameter is less, there's going to be more resistance. It's going to be harder to push the blood through a smaller diameter, which means total peripheral resistance would go up. So when we look at factors affecting blood pressure, we need to consider also a fourth one to consider is blood viscosity, the thickness of blood. So if all of these are up, it means total peripheral resistance will go up. Well, I guess actually I should probably clarify that a little bit. Let's take this out of here. So we would say if blood volume is up, if blood vessel length is up, if blood viscosity is up, but with blood vessel diameter, what we're talking about is if we want total, if total peripheral resistance is going to go up, it's because there is vasoconstriction more than vasodilation. Okay, so in other words, when we look at blood vessel length depends on tissues and cells that require a blood supply. So if we say that the more blood vessel length we have will increase total peripheral resistance, we can see that if we increase total peripheral resistance, what's going to happen to blood pressure?
It increases.
Yeah, it's going to go up. And we've said that generally we want to keep blood pressure within these parameters here. And if we get blood pressure going too high, it becomes a pathology. So if we're saying blood vessel length is dependent on the tissue and cells that require, the bigger the person, the more blood vessel length. The more weight gain, the more blood vessel length. And the reverse of that would be true. If you lost weight, you would reduce the demand for blood vessel lengths. That would reduce total peripheral resistance. So obesity increases blood vessel length, which in turn increases total peripheral resistance, and that causes an increase in blood pressure. So that's how we can use this equation to explain changes in blood pressure. So if you look at this equation and we say, what would you expect is going to happen to blood pressure during exercise? Would blood pressure go up during exercise or down during exercise?
It would go up.
Yeah, it would go up because we understand that cardiac output has to go up during exercise, right? Or any other fight or flight scenario. And what happens when we go through fight or flight is that overall, there's going to be a vasoconstriction of blood vessels to the digestive system and to the kidneys and to most of the skin and so on. And we can see here that if we have an overall vasoconstriction, that's going to increase total peripheral resistance, which means we increase blood pressure. So it's another way to explain changes to blood pressure based on exercise or stress or total peripheral resistance, those sorts of factors that come into play here. So if you gain weight, adipose tissue, if you recall, adipose tissue is a type of connective tissue. It's very vascular. So because adipose tissue is the tissue that tends to increase with obesity, so will blood vessel length. You've got a textbook we used to use in this class before we went to the online textbook suggested that 1 pound of additional adipose tissue adds several hundred miles of blood vessels. Now, I say that the textbook suggested that because I have not been able to find any proof anywhere else other than in this textbook for that statement. But everybody should be comfortable with the idea that if adipose tissue is vascular, meaning it's got a good blood supply, if we add adipose tissue, we're adding blood vessel length. If we add to the equation stress that would promote vasoconstriction, then we're going to affect blood vessel diameter by promoting vasoconstriction. That also would increase total peripheral resistance. If the blood got thicker, that's what the word viscosity is referring to, then total peripheral resistance is going to go up. If blood volume is greater, total peripheral resistance goes up, right? So the reverse of that, think about blood volume. If you have a serious wound that results in blood loss, that means blood volume's going down. What's going to happen to blood pressure?
Low.
Pardon me?
Blood pressure will be low.
Yeah, it's going to go down. And that becomes dangerous. If you lose too much blood, your blood pressure gets reduced too much, you're not going to be able to deliver to all the cells and tissues in the body. That's really what defines the condition called shock, vascular shock, because the blood volume's reduced to the point where blood pressure is affected, can't deliver to all the cells in the body, becomes a life-threatening situation. So we can use this equation to explain those types of features or factors associated with blood pressure. Okay, so that's where the autonomic nervous system plays a role. Remember, I talked about the sympathetic division and the alpha and the beta receptors, right? When the alpha receptors are stimulated by the sympathetic division, vasoconstriction occurs. During fight or flight, the overall result of sympathetic activity is vasoconstriction, except in some specific examples, like the skeletal muscle in the heart. So the result is going to be an increase in total peripheral resistance. Blood pressure goes up. Now, during fight or flight, we expect it to go up. We want it to go up because it's going to meet the new demand. But that's great when it's just during fight or flight. But if you're, for example, under chronic stress, that might result in elevated blood pressure for extended periods of time. That could become a problem for us, right? That's a situation where we're not going to be too happy over a long period of time because the blood vessels are going to be sensitive to that chronically high blood pressure, and they're going to get stiff and thick and be less effective over time. That's the problem with chronically high blood pressure. So too much, too little represent pathologies. We want to keep our blood pressure in the ranges that we've kind of illustrated here to be healthy. And we can explain how we can do that by recognizing the factors that affect total peripheral resistance and the factors that affect cardiac output. Now, we have some other factors that can play a role here, like we talked about the nervous system. So that was our autonomic nervous system, specifically the sympathetic nervous system division. And the endocrine system, we have some hormones that we'll be talking about more when we do the endocrine system. But for now, we'll just mention a couple. There's a hormone called aldosterone. And we'll talk about where it's produced a little bit later, but it acts on the kidney to promote sodium reabsorption. So that means in the kidney, we get exchange. The kidneys are responsible for filtering the blood. So what they'll do is they'll filter the sodium out of the blood, and then in the presence of aldosterone, return it to the blood. That's what reabsorption means. Now, sodium is a salt, right? We're all pretty comfortable with the idea that sodium is a salt or an electrolyte, and it's going to attract water. So water is also reabsorbed. And if water's going to be reabsorbed, we increase blood volume. And if we increase blood volume, that represents an increase in total peripheral resistance. That's going to contribute to the regulation of blood pressure. Does that make sense?
Yes.
Okay, so we have another example of a hormone. So there's a hormone, another example. So aldosterone, let's just summarize what aldosterone did. Promotes sodium at the kidney And what we do to summarize is that water follows. Therefore, we get an increase in blood volume equals an increase in blood pressure. So that was aldosterone as an example of a hormone that can help regulate blood pressure. There's another hormone called, abbreviated as AMP, which is atrial. So you know where it's being produced. Cells, the muscular cells in the atrium are able to produce this hormone. Atrial natriuretic peptide. That's what the AMP stands for. And it's known to be antagonistic. I'll write that down first. So if I tell you it's antagonistic to aldosterone, what does that mean to you?
Probably it mechanism of action can lower the blood pressure.
But I'm telling you that it's antagonistic to aldosterone. So what does that actually mean?
It's opposite.
It acts on aldosterone to lower the blood pressure.
No. You're missing my question. And that's a problem for you if you got short answer questions coming up on a test. I'm asking you what the term antagonistic to aldosterone means. And I think somebody was trying to say so.
It's opposite aldosterone.
Sorry, say that again.
It's opposite.
Yeah, exactly. So if it's antagonistic, it works opposite to aldosterone. So what that means is that it's going to increase sodium excretion. The kidneys either excrete or reabsorb, and water follows. So exactly the opposite of what aldosterone was doing in the kidney. So same location, opposite effects, and therefore decrease. So the gentleman that mentioned the effect, that's exactly right. The effect is to lower blood pressure. But when I ask you what the antagonistic refers to, the effects of aldosterone, that's what I'm looking for. So we get a reduction in blood
So
volume.
I thought you were asking about the effect, but I know antagonist that is the opposite. Okay, I understand.
Yep, just
Thank
that
you.
word antagonistic with respect to aldosterone. So it's going to have the opposite effects. So the kind of interesting thing about the atrial natriuretic peptide is it's located in the atria of the heart. So specifically the right side of the heart. So if venous return is very high because of high blood pressure, this hormone will be produced and signal the kidney to excrete sodium. Water will follow sodium, so the blood pressure will be reduced. That's negative feedback. Both the nervous system and the endocrine system utilize negative feedback to regulate various metabolic functions and activities throughout the body. In this example, we have aldosterone that will respond to low blood volumes, and the result will be an increase in blood pressure. But AMP works antagonistic to aldosterone. The result will be the reverse. But the mechanism is affecting sodium and water. The end result is a reversal of the blood pressure situation. So in the case of AMP, the stimulus was high blood pressure. The result was low blood pressure. That's describing negative feedback. In the case of aldosterone, the stimulus was low blood pressure. There's a signal comes from the kidney in this case, which we'll talk about when we do the endocrine system. We'll bring this one up again. That stimulates aldosterone to be released, that promotes increased sodium reabsorption, water follows, blood pressure goes up. So the stimulus was low blood pressure, the result is high blood pressure, negative feedback, And we've got now between these two hormones an endocrine mechanism for regulating blood pressure. Does that make sense?
Yeah.
Yeah, somebody, you sound like you're not quite sure.
Yeah, please, can you repeat it again?
Sure. And let's let's do it a slightly different way. So blood is filtered by the kidneys. And the kidneys regulate blood pressure. Okay, so our stimulus here, if blood pressure is low, the kidneys signal production of a hormone called aldosterone. Okay, now this takes several steps, which we'll talk about when we do the endocrine system. So for now, we just want to understand that when the kidneys detect low blood pressure, they're going to stimulate the production of aldosterone. And when aldosterone is released, it causes an increase in sodium reabsorption at the kidney, right? This is all happening at the kidney. And water follows, which means that sodium and water are returned to the circulation. That increases blood pressure. So that's negative. That's what the dashed line's showing. Negative feedback. The stimulus was low blood pressure. The response is high blood pressure. As blood pressure gets high, as blood pressure gets low, high, low, high, low. When blood pressure is getting low, we're going to add aldosterone. And when blood pressure is getting high, AMP. Repeat, repeat. And as a result, we get homeostasis. Blood pressure is going up, blood pressure is going down, blood pressure is going up. Does that make sense?
Yes.
Yeah, does that help?
Yes, yes.
Okay, so you could just do the reverse for AMP, right? We would start with high blood pressure, then the hormone AMP is being released. It causes the opposite effects, and the result will be a lowering of the blood pressure. When they're in balance, they maintain blood pressure within those normal ranges. Okay, now, how is the cardiovascular system regulated? Can anybody tell me, because you would have talked about this when you did the nervous system, where cardiovascular regulation occurs? What part of the brain regulates heart rate and blood pressure?
Is it the brain stem?
Well, it's part of the brain stem. Yep. Which part in particular?
the medulla.
Very good. Yep. Medulla oblongata. So our cardiovascular, so the autonomic regulation of the cardiovascular system, the subconscious relays that are going to go on for cardiovascular regulation are occurring in the medulla oblongata. So we have receptors for pressure and so these have a fancy name. They're called baroreceptors. And for oxygen and CO2, those are called chemoreceptors. And they're located in the aorta and carotid arteries. So the baroreceptors, for example, if blood pressure is too low, then the baroreceptors signal neurons in the medulla oblongata to increase, for example, heart rate. Now, if we said that blood pressure was too low, that's our stimulus, right? So what we want to do is increase heart rate so that we increase blood pressure. How do we know that increasing heart rate will increase blood pressure? Because we know that the equation for blood pressure regulation is this equation right here. And we know that cardiac output is a function of heart rate times stroke volume. So if we increase heart rate, that means we're going to increase cardiac output, and that means we're going to increase blood pressure. You see how we can use these equations to explain the physiology of the system. Does that make sense?
Yes, it does.
Somebody was very, very quiet there. What? Yes, no?
Yes, it does.
Yeah, we're okay with that? Okay, so regulation is going to relay through the medulla oblongata, and it's subconscious, so these adjustments can be made without us having to consciously make them. Blood pressure drops, the medulla oblongata will initiate responses designed to reverse that. And the reverse of that is true. If blood pressure is high, then the medulla oblongata will relay responses designed to reduce the blood pressure, right? And the same goes with the chemoreceptors that measure oxygen and carbon dioxide levels. So those are more related to what's being carried in the blood. So the nature of if there's elevated levels of carbon dioxide, then we have to breathe more to get rid of that carbon dioxide. So it's tied closely to the respiratory system, because we understand that the two systems, the respiratory system and the cardiovascular system, are related to one another. And so their regulation is going to be coordinated between the two. Okay, so now we have a couple of ways to be able to discuss regulation. We regulate through the nervous system, through receptors, and we regulate through the endocrine system. through measurement of factors like blood pressure and have some hormones that can respond to those too. So we have a number of different ways that we can talk about cardiovascular regulation. And obviously that's an important thing for us to be aware of. Okay, any questions about what we've been talking about today?